Yes.
Perfect. So thank you for that. And you know, as a clinician and as a practicing clinician, it's been an interesting journey to get into digital health, and it was true frustration probably more than anything else. A lot of us in day-to-day practice, from going from the old paper notes where of course the notes could never be located in the first place, so you were seeing patients and you were relying on them to give a history because the notes were somewhere else, because Ashok had been seeing them in surgery and he hadn't got the notes back over to gynecology, and the frustrations went on. And then during the when I was doing the IVF clinics, we had a lot of legacy systems in IVF that were really not up for purpose that patients were using. So it's through frustration that I got developed. Now, interestingly, the World Health Organization's definition of digital health is the use of information and communication technology to support health. So it is both of those, and I think very much what we see ourselves in Ultra Digital Health, and this came about, as I said, through a conversation with the university and with Microsoft, was very much as plumbers. And I think in digital health, you can put yourself into the field maybe of being a plumber or being a really smart, technician at the other side that does a lot of the AI learning that we've heard a bit about this morning already. But I think there's some entities have jumped very quickly into that sexy part, which might be the AI learning of big data, and without actually being able to get the data into the right position and understand how the data is going to be used. So that's where the plumbers come into play, I think, and that's what we tend to do. So patient-centered care, there's many definitions of it as well too, but this is quite a good definition, I thought, from the New England Journal a couple of years ago. And it outlines a number of touch points where the patient is center to the delivery of that care and support of that care. And where we think digital health might promote that would be the full transparency of the care, the virtual well-being of the patient, and the care is collaborated and coordinated and accessible to the patient. So letting the patient actually be able to see what is happening to them, what's going on. So we're so far behind in healthcare. We've been all used to, in the last sort of 10 years, been able to go online and order our Amazon package, which is delivered to us in the next day in a simple sort of 2-click measure, or go onto our banking, which is now, to the demise of the high street bank, is all mostly online. And again, very quickly, very easy, do financial transactions online. Or through booking our British Airways or wherever it is travel that we're going to go through, very easy to use, intuitive platforms. And this slide from Mark Bretnell at KPMG just shows how far below healthcare has not really got that digital dividend. It hasn't transformed, hasn't been able to move the sector forward in the same way as those other sectors have moved forward. So this in itself presents an opportunity. Because we can harness that dividend still and make things better for us. We've heard already that patients are increasingly using digital devices to manage their health, or how they think they're managing their health. So be it your Apple Watch or your Garmin, where you're looking at your heart rate while you're running or when you're sleeping. And patients we've heard again also already in the meeting today about how patients are expecting this data to be used. But actually, if you look back at the Human Genome Project, there was a similar argument going on at that time whenever patients were being asked to get involved in the Genome Project, and there was a discussion had about, well, I'm not going to give my data to the Genome Project because it's valuable. In reality, your own personal data is actually less valuable or of no value unless you compare it with all the data. And that's where the real value comes, of actually collecting all of the data and being able to put it together and use that then to predict and prevent health issues on a population base, as well as hopefully then individualize later and determine effective treatments based upon that. Now, our world has changed a lot over the last 12, 18 months. We don't need me to tell you that. And this is what a traditional visit to the hospital looked like. It was busy, it was crowded. From sitting in the John Radcliffe, we could see the queues of the cars going right down Headington Hill, where they were backed up and they couldn't get into car parks. However, then we had the COVID pandemic, and all of a sudden the car parks were empty and there was no queues. But interestingly, medicine continued on, and it was an inflection point in our use of digital communication technology, if not necessarily information gathering technology. And we really started to use things differently. NHSX, which has been around for longer than the pandemic, did have 5 missions that it set out when it was set up. And those were really to reduce the burden on the workforce through digital technologies, give people the tools to access information and services directly, ensure information about people's health and care was safely accessed, aid the improvement of safety across health and care systems, and improve the health and care productivity with digital technologies. So that's very easily said, and paper very seldom really refuses ink, and delivering a PowerPoint presentation is much more different than delivering an actual a product or a procedures, and NHSX have faced many challenges, and a lot of that has been down to the legacy systems that currently exist in different technologies. And so at OXDH, what we very much said was, look, the idea that we're going to actually ever replace, in the first instance, the legacy systems like Cerner or Epic or EMIS or others, is actually, that's you're certain to fail if you try to do that in one big move. But what you could do is maybe try to develop care pathways and that are much more intuitive and easier and cloud-based, link them into existing legacy systems through FHIR and through HPL7 links. And then, of course, very importantly, give the patient-centric approach to that by having a patient portal whereby they can see their information, they can see their records, they can get easy, quick access, they can upload through their patient portal information into their care system and into their networks, which can then be used. And even things like cloud-based PAC systems, where you can get second opinions on your MRI or your CT by quite easily sharing your records. In the same way as you might share your Facebook, you're not my friend, I share my Facebook with you, but I'm not going to unfriend you because I've moved actually to Australia and I want to share my digital records with somebody else. So it's trying to bring all of those data points, which sit at the moment in individuals in multiple silos. And what we want to try to do through the systems that we're developing on a Microsoft really stack system is to try to link them in together and coordinate them and give patient access. So one thing that we're about to launch, or we have launched in another country, is a virtual hospital where we've got a much better, it is virtual. Again, one of our earlier speakers was talking about how, why do we need, have we moved away from the healing hands where we need to set our hands onto patients in order to heal them, or can we do a lot of this remotely? So in this case, Jane, she wants to register to be in part of this virtual hospital. She does it in a very similar way that she'll register for her Amazon or for Netflix through an automated email system, which might be helped by a real person. That administrative is going to, through the administration and registration rights, will collect the initial information. Then we'll send out a very quick acknowledgement, and we can also send out consent forms with full auditability, which can be signed through DocuSign or others. Then once the patient is signed, the patient can actually see who's available in the hospital, what is the availability of, if it's an orthopedic surgeon or a gynecologist, they can publish out their calendars and see when they're available for online syncing. Now at this stage, you're going to have two systems between your public and your private. In the private, it'll be quite easy. Jen can book directly with Steve. In the public system, it may be that she needs a GP gig system in order to organize that consultation. The virtual consultations we've heard about already, but there are many ways that we can improve. People have been negative about virtual consultations because they miss those subtle interactions that you can get when the patient's sitting in front of you, about maybe how nervous they are, where they're looking to, or they, things that you pick up that are subliminal messages. But actually through using cognitive services, through the AI video, we can actually get an objective measurement of that as opposed to our subjective feeling, which is of course very important subjectively as clinicians. That's what we're trained for, and we've got experience in that. But having that objective through this AI learning can be quite good. Things even like the ability to, with a 90% accuracy, diagnose a COVID cough based upon that that interaction is quite important. Then Steve, who will see them and through things like the nuance, can actually do a real-time transcription of that consultation, and also if it's underpinned through Business Central and others, then you can actually generate invoices to CCGs or whoever. Then if you need to have a referral on for ultrasound or for imaging, then that can be done through direct email referral across to the virtual imaging department or through to the pharmacy. Then we can actually link these all into existing legacy systems through FHIR and through HL7s. And again, very importantly, we can have this patient portal where the patient can see all the time what's going on with them, and they can contribute to that activity, and they can also see what's happening and move things forward. So I think that they are, the world is changing, and it's very unlikely that we're going to go back to where we were. I think there has been maybe an overswing because of COVID, but we will relax back into a situation. But I think there is the ability to grab that digital dividend in healthcare that we have been missing. I think there is changing the way that patients expect to interact and engage with the providers. That has changed, and people don't really want to sit in crowded waiting rooms any longer. We really need to rethink and rework an effective patient engagement strategy and platform of how we're going to do that. And again, interesting to hear about those, tens of thousands of apps that are out there and the noise that is in that activity, and how we actually streamline and make that better. But hopefully we start with getting the plumbing organized first. We need to understand the touch points that we have with our patients, mapping common journeys, and building the clear picture of how we use the data that is there already and how we use further data, so we don't get, as described earlier, this vomiting of data into the system that actually is of no use to us. And we need to create a personalized and tailored view of each patient and deliver real-time and continuous interactions between patients and caregiver. Also realizing that patients actually will also have increased expectations, as we're finding now. Patients might email their doctors very quickly when they're sitting at home and they've got a quick question. We need to be able to streamline and make that much more an effective use of time. And that can be with using things like healthcare bots in waiting rooms, virtual waiting rooms that we've created. And the bot can interact and actually, through time, that bot's learning an ability to answer questions and collate information that can then be delivered to a doctor at fixed times for a response. So that was a very sort of overview of where we are, Ed, with that. There are many more questions than answers, I think, but it is a very exciting space that we're in at the moment.